To this now, the National Institute for Communicable Diseases, or NICD, has issued a statement advising members of the public to review the vaccination status of their children following, of course, an increase in diphtheria cases. The Institute has noted that since the beginning of 2025 to date, about 40 individual cases of diphtheria have been confirmed in South Africa. And of these, 19 had symptoms and 21 had no symptoms whatsoever. And for a better understanding on this disease, we have then roped in Professor Cheryl Cohen, who's the head of the Center for Respiratory Diseases and Meningitis at the NICD. Thank you so much for your time, Professor. Welcome. So let's first talk about this reported increase in these cases of throat as well as nose infections or diphtheria. What is actually causing this latest upsurge?
Yeah, so good. It's afternoon. Good afternoon, and thanks so much for having me on the show. I think this increase in cases of respiratory diphtheria is really a result of a drop in the vaccination coverage. Some of your viewers may have heard of diphtheria, and they've probably heard of it because it's part of one of the common vaccines that we give in childhood, the DTP vaccine. And in fact, diphtheria it's a vaccine-preventable disease. All children should be vaccinated against it in childhood. And it's a disease that we haven't seen or has been at very, very low levels for many, many years. But now we are seeing a resurgence in cases in South Africa. South Africa is not the only country. There are a number of other countries in Africa that are also seeing an increase in diphtheria cases. And it's not fully understood, but it's thought that one of the main contributing factors is that, in part because of the SARS-CoV-2 pandemic and the impact on health systems, our vaccine coverage in young children has really gone down, and it has allowed this bacteria to start to spread and start to affect our communities. And we're really seeing a disease coming back that, as I've said, hasn't been common at all for many, many years.
Professor, maybe let's backtrack a little bit for better understanding. What exactly are we referring to when we say diphtheria, and what actually causes it initially?
So diphtheria is an infectious disease. It's caused by a bacteria called Corynebacterium diphtheria. And it's a bacterium that lives in your nose and throat. It's spread through respiratory droplets, so really similar way to flu or SARS-CoV-2 or other respiratory diseases, but this is a bacteria, not a virus. And what diphtheria does is, as the bacteria, is it produces a toxin. A toxin is a kind of a poison that the bacteria makes. And what happens is when it's in your throat, it can make this toxin, and this toxin basically causes the tissue in the back of your throat to die. And that can cause a very severe inflammation of the throat and eventually block off the airway of the person so that they can't breathe at all. So it's a severe disease affecting the throat that really can cause obstruction of the airway. And as I've said, it's spread between people, but we do have a vaccine that can protect against it. And in fact, the most important thing we need to be doing is really getting our vaccine coverage up in children and making sure that we take our children to the clinic to get the routine vaccines at 6, 10, and 14 weeks of age. And for this bacteria, what's also really important is those booster doses. So the first 3 doses, 6, 10, 14 weeks, often children get really good coverage of. But we sometimes forget that they're supposed to come back at 18 months, and again at 6 years, and again at 12 years to get those booster doses. And the booster doses are there to make sure the immunity lasts throughout childhood and into adulthood. And it's particularly these booster doses that children are not getting, and that's leading to this immunity gap, which is allowing the bacteria to spread. And so that's really what parents should be doing, is taking their kids in for their primary doses and their booster doses to stop the spread.
So basically, Professor, you're saying it's not commonly found among adults, is what I'm understanding.
Well, so historically, it's not been commonly found among adults. And what we know is that children are driving the transmission of the bacteria. So children are the ones who spread it, like many other respiratory diseases. Interestingly, though, in this outbreak, in fact, the majority of cases have been in adults. So about 2/3 of all the cases we have seen are in adults, mostly young adults under the age of 40. And that's why I'm really emphasizing that it's not only those first few childhood doses at 6, 10, and 14 weeks, but it's also the booster doses at 18 months, at 6 years, and 12 years that the children need to be getting, because it's those extra doses that give the protection that then lasts into adulthood and that really stops the spread. So historically, it was really always a disease of children. In this outbreak, we are seeing more cases in adults, but it's probably driven by that immunity gap, because it's really the very few parents currently are taking their kids for those booster doses, and we really need to increase the coverage and make sure that people bring their children in for those vaccines.
Absolutely. So there needs to be a follow-through with this vaccine regime there, Professor. So in my intro, Professor, I also indicated that of the 40 cases that have been confirmed so far in South Africa, it says 19 actually had no symptoms, right? So let's talk about what would cause this, and then maybe also take us through some of the most recognizable symptoms that should actually prompt for further medical inspection.
So that's a really important question. And this, again, like many respiratory pathogens, this is an organism that you can have in your throat and only goes on to cause disease in certain people. Now, the vaccine that we have, in fact, the way it works is to prevent a person getting sick with diphtheria. It doesn't necessarily protect you having it in your throat. So most of those cases that we see where we find the bacteria in a person's throat but they're not sick, it's because they had the vaccine and they are actually protected against getting more sick. But they are important because they can potentially spread the bacteria. So the vaccine reduces the spread, but it doesn't completely eliminate the spread. Now, very important is what are the signs of symptoms. And as I've said to you, this disease is a disease that infects your throat. And so the most common sign is a very sore and inflamed throat. And actually, when the doctor looks inside, they'll see something that's called a pseudomembrane, which is really what I described before. Because the bacteria actually kills the cells at the back of the throat, what the doctor will see is like a membrane at the back of the throat that's very typical of diphtheria that can then block off the throat. Along with that sore throat, you get a very swollen neck. And the word they use, they call it a bull neck, which is a very, very big glands in the throat. So the classic signs are this very severe sore throat with a membrane and then a very swollen neck. And it's very important that doctors be aware that this can be a cause and look out for it. Obviously, sore throat is quite a common symptom, right? There are lots of other things that can cause a sore throat. So it's not every sore throat that's diphtheria. Most sore throats are caused by viruses or maybe the bacteria, the strep throat that we commonly see. But in the subset of severe cases, it can be caused by diphtheria. So doctors and nurses need to be aware of this and look out for that classic sign, which is really the membrane at the back of the throat and the very, very swollen neck that will tell the doctor that they should think of diphtheria, or the nurse, in this situation.
Professor, we really appreciate your input as well as clarity this afternoon. Thank you so much for your time. That is Professor Cheryl Cohen there at the Center for Respiratory Diseases on the rise of respiratory cases here in the country.